we have Dr. Andrew Orr, who is a traditional Chinese medicine practitioner, and you have a master's in reproductive health, and you are the founder and the owner of Concept Shen. And you run a clinic in Queensland, Australia, where you specialize in reproductive health. And you also have an expert panel program whereby you have a very, what I consider a real naturo approach, because you address the biological aspects of disease with herbal medicine, but then you also incorporate the physiological aspects with physios, and also the mental emotional aspects with psychologists, which I love. But then on top of that, you're very integrative, because you see the necessity for surgery, of course, for progestin and other hormone replacement therapies.
Well, yeah, so like you said, I do an integrative medicine approach. So I've got a master's in reproductive medicine and women's health medicine through the Faculty of Medicine here. But I've also got all the holistic medicine degrees. So I've got 8 degrees all up, and I combine them all 8 from nutritionist, naturopathy, Chinese medicine, herbal medicine, and yeah, so I combine them all together to what we call sort of that multimodality integrative medicine approach. So people get a bit of everything, and you know, no one medicine's got all the answers. So I try to bring it all into one to give people what they need. And if they need surgery, sure, we'll do that. But if they don't, and even if they do, we still got to offer that support before and after, and but offer the holistic approach and look into things that others miss. Like I say, the no stone left unturned.
Mm. And so I see a huge gap in the market, especially over here in the UK, whereby practitioners, they're not really specialized in reproductive health, but they're doing it. It's kind of like, well, there's a lot of female practitioners, so like, well, I have a vagina, so I know how to treat it. It's kind of that approach.
Right.
And I hear over and over again, like the same protocol of, okay, if there's PCOS, if there's endo, if there's dysmenorrhea, then there's this standard protocol of, okay, omega-3s, rosemary extract maybe, indole-3 carbonyl, your cruciferous veggies, Vitex, black cohosh, wild yam, wham, bam, there you go, ma'am. Like, that's it. And yeah, I'll be really transparent with this podcast in that I'm really hoping that some of our natural medicine practitioners will hear this and jump on board your protocols to become more specialized in the area of reproductive health, using protocols that actually work.
Yeah. And look, I see this is one of the things that I talk about a lot too. Like, say, for instance, we were talking about our medical colleagues. They can't go out and call themselves a specialist unless they've done postgraduate training. Mm-hmm. But a lot of natural medicine practitioners only learn, you know, this much in college, and we have to be honest about it. And then, like you said, you know, a lot of them probably are women and think, well, I've got a vagina, so I know all about women's health. And the problem is they don't, and this is where they're failing. And we always say that just because you have a disease doesn't make you an expert either. It's like this, and because you can get into some real trouble with patients when it becomes difficult. If you can do a little bit in it, if it's easy, you know, you might fluke your way through it and things like that. But then when we get into the area of like PCOS and so PCOS, endometriosis especially, and then we look at adenomyosis, but then fertility, which then goes into the genetics and all these intricate little details, that's where practitioners get lost. And they're using this blanket approach, like you said, and it's not working. And they only get so far into it, and then patients then lose faith in natural medicine as well. And then they've lost faith in the Western medicine because they're missing things as well. And we see this whole thing. And so even in Australia, like there's lack of regulation on both sides of medicine. So there's lack of regulation for medical practitioners who do fertility, and then there's lack of regulation for natural medicine practitioners. So it's a big issue, and we're letting people down.
And there becomes a collective of people who are just out there doing their own research and just kind of clutching at straws. And even in the last month, I've met so many people who have endometriosis, have recently been diagnosed or in the process of getting diagnosed, and just at a loss of what to do. Yeah. So what would you recommend to those people?
For those people, for practitioners especially, upskill for a start, because endometriosis it's a hard one, and you have to work in with a medical specialist whether you like it or not. But you can do a lot to help these people too in the management of it moving forward. But if you're a patient,
management and to stop it from regressing.
Correct. Yeah. But if you're a patient, always say, look, early intervention, see an expert, someone that actually knows what they're talking about, and this is what happens. Because, you and I probably see it. It's especially me see it because I get the laparoscopic pictures, what the surgeons send through, and you see these women with their organs stuck together because they've seen this practitioner for years and years who said, oh, yeah, I've got it sorted. And they haven't. And
how frustrating.
So it's a big problem, and we don't realise that those lack of skills that a practitioner might then, could do damage to a person physically, mentally, and then on a reproductive level, that person might not be able to conceive because you have failed to refer on, or you've worked out his scope of practice and so forth. So.
And in your is it called expert panel? Correct me.
The experts program.
Experts program. Within that, you actually have surgeons in there who are specialising in laparoscopies. Yeah, is that correct?
Yeah, that's correct. So we use advanced trained surgeons. And the reason that we use an advanced trained surgeon is because any gynecologist can do a laparoscopy, but doing one well and at the level that you need to do with endometriosis is a whole different story. So these advanced trained surgeons do about 5 years extra surgical training on top of their gynecological surgical training. And then they have to do a certain amount of surgeries per year to maintain their advanced trained status. So these guys are the best of the best. And that's what happens to a lot of women is they see these gynecologists, just like they see natural medicine practitioners who aren't proficient in what they're doing and have got the basics, but not enough to help these women. And so they think, oh, I've had surgery, and they haven't really. They've basically had a little minimal amount of surgery. But even a little minimal amount of surgery can also help. I was talking to a specialist, one of our advanced trained surgeons, and he said, I went into a lady and her whole pelvis was full of adhesions. And he said, I saw her ovary was twisted, and he said, I was going to leave it because he said, I actually had to go back in and basically, bring someone else in to help me do the next surgery because all the bowel was all entangled and everything as well. He said, while I was there, he said, I couldn't help myself. I just untangled this ovary. And the lady woke up and said, a week later, said, oh, my pain's gone. And he said, oh, I didn't do anything. I just did one adhesion and that's it. And he said, that's what I mean. Minimal surgery can produce a lot of results, but it isn't what she needed. She needed to have the whole lot tidied up. So imagine when she gets it all tidied up. Yeah.
So that's an important aspect for a holistic approach, is getting the right surgeon as well as the right practitioner.
Correct. Yeah.
And what do you see as the main causes of endometriosis? And do you think it's growing, the rates that it's being diagnosed, or does more people have it today?
Well, Well, we know a lot more about it now. I mean, we don't really know how it starts, but we do now know that it's genetic. We know it's hereditary. And there is a hypothesis, it's only a hypothesis, that all women have it. It's just whether it expresses in their body or not. So if your mother has it, then there's a high likelihood you have it. And I suppose it's like a lot of diseases that we all get, you know, like if mum has diabetes or dad has diabetes, there's a good chance, you know, I might get diabetes if I don't look after myself. Mm-hmm. And I think this is the biggest thing. And then we know that estrogen drives it, but we've got so many environments. So there's 87,000 environmental estrogens in our immediate environment.
Yikes.
So that's from a study from the US Department of Science. So it's a lot, you know, like plastics. We've got plastics, preservatives, detergents, petroleum products. Then we've just, you know, we've got the pill, that gets back in the waterway and all kinds of things. So
toxic environment.
It's a toxic environment, definitely drives it, yeah.
And is that part of your protocol to remove the environmental toxins?
It is. It's part of looking at every aspect of it. So environmental, chemical, physical, emotional, you know, whatever, you know, looking at saying, well, does that person use a lot of plastic? Do they microwave everything they cook or things like that? Or, you know, what's their water supply like? And yeah, looking at that, and then stress levels, but then also asking mum's health history. So, you know, what was grandma's? Grandma had a hysterectomy. Oh, really? Oh, yeah, mum had one too. And it's sort of going through that, and it gives you a pretty picture. And then you can say, well, you've got a daughter as well, and oh yeah, she's getting period pain too. Mm-hmm. And it's just putting it all together and saying, well, you know, there's that family history. It's there. It's like, I suppose it's like cancers. We all come in contact with cancers in our body, whether they express or not is a different story, but we all have that propensity. And it's the same with women with endo. But it's definitely more and more, we're seeing more and more, but the diagnostics are better now for it. But I mean, the diagnostic is a laparoscopy, which let's hope they find something that's a little bit less invasive. But
mm-hmm. And what part does mucus have to play in the progression of endometriosis?
Not so much with the mucus kind of thing. They used to think, you know, retrograde menstruation was a big part of it, which it probably is, but we also know that most women will have retrograde menstruation at some time in their life. So they thought that's how it was being transported, because it can transport to every organ in your body. So it's probably more traveling through what they think through the lymphatic system more than anything. And the best way to describe endometriosis, it's a cancer. And look at it like a benign form of cancer that can spread anywhere, because they've found it behind the retina, they've found it in fingers, they've found it in joints, they've found it. The head of Endometriosis Australia here, she's got pericardial endometriosis, so it's in her thoracic cavity around the pericardium.
And
it can get everywhere.
Treat it holistically and to treat the body systemically, incorporating the psycho-spiritual, emotional side of things as well, which is something that I really enjoy, because I feel like it can bypass a lot of the biological medicine if we can get to the root cause, the root emotional stuff, and to the ancestral stuff as well, through breath work with naturotherapy, through using a yoni egg and reflexology for the vagina and crystal wands and things like that, getting really, really deep, then it can dissolve a lot of symptoms very quickly. Yeah.
Oh, absolutely. I'm a big promoter of using things like yoni eggs and wands and things, because a lot of the women, for a start, even if we just look at it a pure physiological aspect to it, they've all got pelvic floors that are like this.
Mm-hmm.
They're so tight. So we've taught women so long that their pelvic floors are loose and you've got to tighten and tighten and tighten. But a lot of these women with endometriosis and some have got high anxiety, they're high stress levels, they're more sedentary, so they're sitting a lot more. The pelvic floor is just like a rock. And we've got to get that blood flow in there. And like you said, the emotional aspect too, if they don't, it's the one area that they often fail to do is that highly emotional. But getting women more in touch with their their femininity, and that it's okay to explore those parts of your body and work out how it works, what it does, whether it's for pleasure or whether it's for a purely physiological exercise. Getting women more in touch. I mean, guys need to as well, but especially women, it's been such a taboo subject for so long.
It's been suppressed for so long, and then it's become literally stagnant, like that pond with no movement. So literally all we need to do is start to move that area of the body. I often in clinic, I don't practice anymore, but when I did in Ibiza, I would advocate belly dancing. Belly dancing and any kind of movement, any exercise, but specifically moving the pelvis was very helpful.
Yeah. And getting women in touch with that femininity too, and as we say, polarize themselves, because that, in this day and age, women are more in touch with that masculine do, career, go. And it's bringing them back into their, like I say, polarizing, but just back into touch with themselves and really understanding themselves and letting go. And like you talked about in the beginning, with your meditation, is opening up their heart. And we know body-mind medicine now is so important, but it's still one of those taboo subjects too. It's like, oh yeah, but if I do that, there's something wrong with you. I've got a mental problem, or it's like, no, talk about it, express.
Yeah. Well, Real Natura is like kind of bursting that bubble, and I really hope that practitioners in the holistic health arena, where the majority are women, that they are the ones to kind of be the way showers by getting in touch with their body, with their womb energy, with that fire, and their sexuality and their sensuality. And then by example, they can help their clients as well.
Yeah. And you watch a woman when they do belly dancing or some form of sensual dance, whether it's like bachata or something like that. And you watch their whole personality, their persona, the way they walk, the way they talk, everything just opens up. And it's such a beautiful thing to see that inner radiance come out. And it's not this airy-fairy thing that a lot of people think it is, or it's hippie or whatever. It's a real thing. And I think that's where a lot of these women are suffering, and why, and like you said, that stuck energy. Like in Chinese medicine, for instance, when we talk about clotting and that dark blood and stuff that we see with endometriosis, that's blood stagnation. So it's pure stagnation. And how do you move stagnation, like you said, is move your body. And that's why exercise is so important. Pilates, using the yoni eggs, get the blood flow in there. It's just another organ, isn't it? It's another muscle. Exercise it.
And would you give the same advice for polycystic ovary syndrome?
Pretty much. A little bit different in the fact, I suppose, a little bit different in the fact that we know that insulin resistance plays such a huge part with polycystic ovaries. So they've got to be even more diligent with their diet. But it's the same with women with endometriosis. If you have a low inflammatory based diet, you're going to have less inflammation in the body, less pain, less everything. Mm-hmm. So it's basically the same. And we know that even now, medically, they're actually looking at that women with PCOS suffer, a high lot of them suffer anxiety and depression. And
so it's again that constriction rather than the expansion. And I used to see in practice as well a lot of IBS that was linked to PCOS and endometriosis. Does that ring true to you in your practice?
Yeah, absolutely. It's one of the things I teach in my expert program to all practitioners, that if you see someone that says, oh, I've got IBS, start thinking endometriosis straight away. And because a lot of women are misdiagnosed as having IBS because they go into I've got all these bowel things, and then they just focus on that rather than, oh, hang on, endometriosis can affect the bowel. And then, you know, a lot of women with endometriosis have PCOS as well. So they have this comorbidity, but, you know, they've got two things going on, and some of them have three. So some of them will have PCOS, endometriosis, and adenomyosis, because adeno and endo are basically the same disease, but just in different locations. So.
Okay. And what would be, if you could give advice to any holistic practitioners who are treating women with these conditions right now, what would your advice be?
Be appropriately qualified, and do the extra training, and go and learn. If you don't know, go and go and work with a mentor, or work with someone that does know about it, that can guide you every step of the way and show you. Because the one thing we see now, practitioners think that they're researching when they do a Google search, and a Google search could take you anywhere, and it could be biased information, old information, and let's face it, most of the current studies are locked behind closed doors unless you pay for a subscription. But yeah, go and be appropriately qualified and become an expert, so you can say, actually, I've got the qualifications, I can do this, and then you can be more confident in what you're doing.
And do we take on practitioners in your expert panel who are in the UK or in Europe?
Yeah, that's the whole aim. It started out as a national project. It basically was modelling what I did. I've got a symbiotic relationship with surgeons, physios, counsellors, and we all work together for the greater good of the patient. And so I started that model, and then brought in all the surgeons and specialists, and then am now training naturopaths, nutritionists, holistic medicine practitioners, like a condensed version of a master's program, which could cost you $50,000. But condensing it, because in a master's program, you don't learn protocols, you don't learn practical applications, you just learn straight theory. And so that's what I've done, condensed all into one.
And how long is your program?
So the initial program is 3 days intensive training. So we go through everything to do with women's health, endometriosis, adenomyosis, fibroids, everything, you name it, cancers in women. And then we go through every aspect of fertility, right through to IVF drugs, the whole lot, and what happens in a lab, all that kind of stuff, testing, genetics. And then we've got a whole module on males as well, because what I see is a lot of women, like you said, a lot of women are practitioners, and they'll only treat the woman, and they forget one of the most important aspects.
Infertility, man as well. Yeah. Absolutely.
It takes two people, but a lot of people are just treating one. They're just treating the female, and
a lot of pressure.
It's a lot of pressure, and it's reinforcing that the women are the issue, which is really bad too. But 50% of fertility issues are males. 85% of miscarriage issues are related to males. So males are the bigger part of the problem.
All right, brilliant. And is there anything else that you wanted to cover, Andrew? You're going to keep it short and sweet.
No, I'll keep it short and sweet. The main thing is really just like you were talking about from the get-go, is just being a better practitioner and better skilled at what you're doing, so that you can help these people, and you can. But if you don't have the tools, you can't. So get the tools and then go and help people.
Yeah. So on our Real Talk forum, we're going to have a resource area on there. with Concept Shen, which is your products, with your expert panel with information where people can go and find out how to get onto the course. And also we have a whole area for referrals as well. So if anybody's listened to this and just thought, oh, I don't want to treat endo anymore, your referral in there and somebody else will pick it up, and vice versa. Yeah, it'd
be great, because we're looking for more practitioners internationally, especially in the UK and the US, because there's people screaming out for experts. And we want holistic medicine practitioners, we want medical practitioners, and that way we can all collectively work together and help each other.
Absolutely. I think it's important to have that holistic approach where, you can go into the esoteric and more multidimensional aspects, but you absolutely need people who are going to stay in their lane and be like, okay, we're doing biological medicine here and the physiology, and then the other side, okay, I'm emotional, mental, and then the other one is the psychic and the spiritual. And it's important to have experts in each of those, not one person kind of muddling with all of it, because that's when it gets confusing. And I really hope to get clarity around that.
Yeah, and that's what it is. It's everyone staying in their lane, staying in their scope, and just working together and going, well, my strength's in this. Your strength's in surgery. Yours might be esoteric practices. Yours might be counselling, psychology.
Mine will be the movement. Mine's going to be the dance. People flowing and embodied and feeling into their sensuality. I'm going to call that
one. Okay, and you can teach them how to use all the yoni egg practices.
That's the sass, yeah. Brilliant.
Absolutely. We need more of that.
Brilliant. Well, thank you so much for your time today, Dr. Andrew Orr, and I look forward to another podcast very soon.
Thank you so much, Chloé. It's been a pleasure.